Kia ora team, my name's Ben and today we're going to go through a basic hamstring massage. So again with the draping, everything that we aren't going to massage is draped. If you'll notice, you ask your client how high they want the massage to go, and then the draping stops at that line. So it's good so they feel safe and comfortable knowing what they've consented to be massaged. The draping then tucks under the other leg to keep it nice and stable. Okay, and we begin. So again, applying lotion to your hands first, then Effleurage. So gently introducing touch and making sure the lotion covers all the areas we're about to massage. And so remember, one of the endangerment zones or vulnerable parts of the body is the popliteal fossa. So remember, we don't do deep techniques directly over that. Once we've done our effleurage, we can begin following the hamstring up with our Petrisage. Feeling the tissue, taking it nice and slowly, getting a sense for any tension and tenderness throughout, and also communicating with our client as to how much pressure they desire. As we do strips, we make sure we don't miss any spots, and we can compare the medial and lateral side, noticing for any past injuries or tension that we may come back to later in the massage. And returning to Effleurage. Then we can do our deep thumb strokes. So again, either a single thumb coming up or piggybacking one thumb over the other, and keeping in contact with your client so they can be aware of the depth and pressure, if it's acceptable or too much or not enough. And back to Effleurage. So by now you'll have a good sense of the tissue, and you'll be in communication with your client as to any area of tightness that needs you to work on. So we can go back to that area with your thumb circles or your double thumb circles. And returning to Effleurage. we can knead the posterior thigh, so scooping up, squeezing the tissue and letting go, and making sure we get as much of our hand in contact with the thigh as we can. Just squeezing and picking up the tissue as we knead the hamstring. And again, checking with your client for how much pressure they desire. And easing back off. So Effleurage. And then we can ring, so just leaning and taking the hands in opposite directions. Always being mindful of the popliteal fossa, we don't want to go deeply through the back of the knee, and always being aware of where the draping is as being the boundaries of where the massage finishes. And we can effleurage again. And then drain. So forming a cuff and draining up through the thigh. Always remember to finish off your stroke laterally. And then some gentle effleurage before we finish off and re-drape our client, and then just gently jostle any extra cream or lotion. Okay, and we are done. Massage done.